Welcome to a special edition of the Plain English Public Health Weekly Report. I'm Richard Greenland, and this is July 3rd, 2020. As always, we'll go ahead and start with our COVID-19 statistics. Worldwide, we have more than 11.1 million cases and nearly 530,000 deaths. In the United States, we have nearly 2.9 million cases and around 132,000 deaths. Due to the strong resurgence of COVID-19 cases these last couple of weeks, we here at Plain English Public Health have decided to go ahead and have a special edition dealing specifically with a couple of issues that have come out a little bit more here recently. Some of the oppositions that people have had to the measures being put in to fight COVID-19. Before we delve into those issues, though, let's get a little bit better idea of where we're at with the whole situation with COVID-19 right now. This past week, the World Health Organization stated that the worst is yet to come. They also stated that lockdowns may become necessary again in some areas. The CDC, the Centers for Disease Control, said that there's too much virus in the United States right now to get it under control quickly. Too many people are just not following the guidelines that the CDC has put out. They said that it is actually surging more than it was in March and April, which was the prior months that were the highest. And they said that this virus is not going to go away on its own. It won't go away until we finally have a vaccine, but people can help reduce the spread of the virus right now by practicing social distancing, wearing face masks when you go out in public, and washing or sanitizing your hands. In addition, Dr. Fauci warned that even if we have a vaccine, it's not going to just magically make the virus go away unless people actually get the vaccine. If people start refusing to get the vaccine for whatever reason, it's not going to make the virus go away. So, even with all that information coming out this week, there's still quite a bit of opposition to those guidelines that have been put out to fight COVID-19. So, we'll deal with a couple of those issues. The first big one is we're going to talk about the public's perception of the death rate and overall danger of COVID-19. Last week, we mentioned that the CDC estimates that the true actual cases of COVID-19 are probably about 10 times the amount of confirmed cases. Some people took that information to mean that COVID-19 is not that dangerous. Their reasoning is that if there are more cases, then doing the math, that means a lower death rate, a smaller percentage of people dying from getting COVID-19. Also, kind of in conjunction with that, the myth about COVID-19 not being as dangerous as the common seasonal flu also reared its ugly head again. So there are at least two things wrong with that kind of an outlook. First off, the flu has about a 0.1% death rate in the United States. Counting only the confirmed cases of COVID-19, the United States would have about a 5% death rate, which is about 50 times the amount or the death rate of the flu. Thankfully, we don't usually consider just confirmed cases for the flu, and we don't need to for COVID-19 either. We can use the estimated cases for that, and that becomes more accurate. But even doing that, even using the estimated cases, COVID-19 turns out to still be 5 times more deadly than the flu. Even with, even if it's not considering the death rate, COVID-19 also spreads a lot more than the flu does, and so it's able to hit more people. So definitely not just the flu. It is not the same as a flu. That is a complete myth. It is not based on facts. Secondly, even if the death rate were somehow to drop below what the flu death rate is, the COVID-19 actually causes a lot more long-term side effects and health issues than the flu does. In public health, we're concerned about death rates, but we're even more concerned about what are called DALYs, or disability adjusted life years. On our website, plainenglishpublichealth.com, we actually have an entire blog article dedicated to explaining what these DALYs are and why they're important. And that link is down in the description below the video. In short, though, A DALY is a way to measure the loss of quality of life, not just the loss of life itself. For example, complications from diabetes can eventually cause death, but most people with diabetes, whether it's type 1 or 2, will live with challenges, whether that's medical challenges, emotional challenges, economic challenges. They'll typically live with challenges for many years or even their whole entire life when you take into consideration diabetes type 1. Just because someone doesn't die from COVID-19 doesn't mean that they're unaffected. Many people are left with serious lung, artery, and heart complications that can make their life difficult, and it can even cause them to experience a higher risk of premature death. So while COVID-19 might not kill them right now, the side effects from it may end up killing them later down the road. Opposition to CDC guidelines because people believe that COVID-19 is not dangerous is just not supported by the facts. COVID-19 is dangerous. We need to be aware of that. We don't need to fear it because there are guidelines that can help us to stop the spread, but we do need to be aware that it is a dangerous virus. The second big issue we'll be talking about this week is opposition to wearing face masks. The opposition to wearing face masks mainly falls into 5 categories. 1, thinking COVID-19 isn't dangerous. 2, wanting to get infected because of a belief in herd immunity. 3, feeling that masks aren't effective. 4, thinking that masks are actually dangerous. And 5, concern about losing civil liberties. So we've already talked today about COVID-19 being dangerous. And we've talked at length in previous weekly reports. You can go back and watch them. But we've talked about the herd immunity, the dangers of herd immunity or relying on herd immunity in many previous weekly reports. So we won't talk about those so much today. What we will focus on are the last 3. So first off, some people believe that masks just aren't effective. They don't help. That's completely understandable to feel that way considering all the misinformation we got at the beginning of this pandemic. We didn't have very much information, and public health officials tried to do the best they could with the information they had. Now, though, we have a lot more information. That information gives us a very clear verdict on masks, and it is that masks help. Different masks made out of different materials provide different levels of protection, but it is very clear at this point that any mask is better than no mask. Basically, make sure that you're wearing a mask in order to protect others. It's not so much about protecting yourself. Studies estimate that anywhere between 50 to 90% of infections are caused by those who do not show any symptoms. They don't show any symptoms. They're walking around, talking with people, doing whatever they normally do, and they're spreading the virus. Since thousands or even possibly millions of people could have COVID-19 without knowing it, it's important that everyone wear a mask when you go out in public. Second, there has been an increase in the amount of misinformation being spread about how dangerous face masks are. Face masks are not dangerous. I'll just get that out there right away. They are not dangerous. The most common bit of misinformation that is out there about face masks is that if you wear them for an extended period of time, it can cause a lack of oxygen or an increase in carbon dioxide right up next to your face, between your face and the mask. Either of those, if that did happen, could possibly be deadly. So it would be a concern if that happened. Studies, time after time, studies have been done, and while they've shown that it could theoretically happen if certain, you would have to have basically a perfect storm of events happen for it to be dangerous, but it's extremely unlikely. We're talking maybe 1 out of millions and upon millions of cases where it might happen. It's not going to happen, basically. You're probably going to win the lottery before this happens to you. If you think about it, doctors, nurses, and others will wear these same exact face masks for 8 hours or longer when they're in long surgeries or other procedures, and they don't faint. They don't die. They're totally fine. Masks are designed to be breathable. Especially, the surgical masks and the N95 masks, they're specifically designed to be breathable while still being effective. Now, cloth masks depend on which materials you use. With those, you just need to use common sense. Almost any fabric will be breathable enough where this will not happen. The only time you'd see something like this maybe happening would be if you can't even breathe through it at all. For example, like a sheet of plastic or rubber in front of your face. If that's sealed off really well around your face, you're not going to be able to breathe anyways, and so of course you're going to have problems. But if you can breathe, then the oxygen is going to get in there enough, the carbon dioxide is going to get out enough, you're not going to have any of these issues. Another common concern with masks is that bacteria or other microorganisms might build up inside the mask next to your nose and mouth and cause you to get sick. Again, this is a possibility, but only if simple guidelines are not followed. Those simple guidelines are, if you're using a surgical or N95 type of mask, any of the disposable types, get rid of it once you're done. Don't keep reusing it time and time again. If you're using a cloth mask, then make sure you wash it every day. You can wash it just in a regular wash cycle in a washing machine with some regular laundry detergent. It doesn't have to be anything special. Or if you don't want to do that, you could also do it in your sink. Just use a little bit of laundry detergent or even just some liquid hand soap or dish soap. Any of that is fine. All of that will be sufficient to get rid of any of the bacteria, microorganisms, or even COVID-19 virus from your mask. So as long as you're doing that at least once a day, then you can continue reusing that mask. Do not reuse any mask, or don't use any mask longer than a single day without either washing it or disposing of it. As long as you do that, you're safe. The last concern that we have about these face masks is the loss of liberty. This concern is much more difficult to overcome because it usually deals with deeply embedded political beliefs. While some governments have started requiring face masks, that's more the exception than the rule, even though this latest surge in cases has started increasing the number of states and countries that are requiring face masks. Most governments are much more willing to encourage their citizens to be responsible in the use of face masks than they are to force them to do so. We here at Plain English Public Health also would like to encourage everyone to use face masks when you go out in public. Wearing a mask may be a bit inconvenient. It may not, look good. It may be uncomfortable, in some cases. But wearing a mask could save the lives of millions of people, especially if everybody does it. Also, in an analysis by Goldman Sachs, they've said that the economy would rebound much more quickly if everyone would wear masks. We're not asking for a lockdown, we're just asking people to wear masks. Please don't be selfish. Think of others, follow the CDC guidelines, let's squish this virus as quickly as we possibly can. Thank you for watching this special edition of the Plain English Public Health Weekly Report. I'm Richard Greenland, and you have a nice, healthy, happy, and safe 4th of July weekend.